I begin by asking my client to move down to the end of the bed so that their feet are hanging off. I then ask my client to actively move her feet as if her toes are going towards the ceiling or as close into her as she can go. This is performing dorsiflexion. I then get her to completely relax her feet so that I can passively move them for her. Here I am pushing her feet as far as they will let me go, making sure that she's not in any pain or is resisting against me at all. I'm now about to perform a resisted movement. I'm getting her slightly so that her foot is slightly dorsiflexed. I will then support her ankle and get her to pull her feet towards her and telling her to try and not let me move her. In this movement, the tibialis anterior will be contracting. We are now going to do eversion. This is being actively done by me telling my client to move her big toe as far outwards as she can. I'm then going to passively do this. I move her heel up so that her knee is bent, so this is easier for me to passively do this for her. I perform this on both legs, making sure she is fully relaxed and that I'm the one in control. We are now going to do this resisted, so I'm going to put my hand on the outside of her foot and she is going to push outwards, and I'm going to tell her to not let me move her. Here, the peroneus longus and the peroneus brevis muscles will be contracting. I will now get my client to actively perform plantar flexion. I'm getting her off the end of the bed so she can get a full range of motion. I'm going to get her to start in dorsiflexion and then to point her toes as far down to the floor as possible. I'm then going to get her to relax completely so that I can passively move her foot. I'm going to take full control and move her foot into plantar flexion. Here the tendocalcaneus or the Achilles tendon will be in use. We are now doing a resisted test. I'm starting her in dorsiflexion and getting her to push against my hand, telling her not to move me. We're now moving on to the inversion of the ankles. I'm describing this to my client by telling her to imagine she's trying to put her big toes together. However, here I realise that her range of movement is being restricted and therefore asked her to move her legs out more. I'm now passively moving her feet into the inversion, making sure that they are relaxed and that she's not in pain at any point. Here I'm looking at her face to see if there's an indicator as to if she's in any pain at all. We are now moving on to the resisted movement. Here I'm telling her to push inwards onto my hand as I push against her and telling her to not let me move her. Here the tibialis anterior will be contracting. I then got my client to perform a functional test of the ankle. Here I'm getting her to do calf raises. This is to see her full range of motion and to see if either side is compensating for the other.